Are you getting the full truth about weight loss meds or just another marketing pitch? Well, as a licensed medical doctor and a certified strength and conditioning coach, I work with hundreds of patients medically on their weight loss. And I've seen how these weight loss medications can help. However, I've also seen how programs like Hims and Hers fall short. So for that reason, we are today reacting to the Super Bowl ad from Hims and Hers to discuss the following questions. One, what's the real reason that obesity rates keep rising? And does this commercial and does Hims and Hers address that? Two, what's the real difference between brand name and compounded semaglutide? And what are you actually getting with Hims and Hers? Three, do Hims and Hers and other online suppliers of weight loss meds, such as semaglutide, provide a real long-term lasting solution for weight loss or just another temporary fix? And finally, four, what is actually required to use semaglutide for lasting, long-term, successful weight loss? So to the ad. Well, from a marketing pitch standpoint, I have it on good authority from my marketing consultant wife that this is a great ad for marketing's sake and great song selection. But those things might make it even harder for us to decipher what the actual truth is and if they're giving it to us. So let's get into the actual medicine of this ad. Well, Hims and Hers starts off this ad by talking about the obesity crisis in America. However, are they blowing it out of proportion, or are they actually not giving it enough credit? Well, they start by saying that 74% of Americans are overweight. And this is definitely a true known stat. CDC publicizes it as well. And being overweight is defined as having a BMI of greater than 25. And even more strikingly, 40% of Americans are obese or have a BMI of greater than 30. And BMI is definitely a very crude measure. It's just weight divided by height. So I have people walk into my office who are a BMI of 32 but have 8% body fat because they just have a ton of muscle. So to see your actual individual impact of that extra weight, it's much more important to do lab work, do a DEXA scan or an ultrasound to determine how much visceral fat you actually have and to determine how that extra weight is actually impacting your lab markers. However, as a greater population-based measure, BMI is a good tool to determine how obese and how overweight the general public is. So, totally agreed, we have a large obesity crisis in America as seen by these numbers. But is that even a problem though? Does being overweight actually lead to negative health outcomes? Well, the ad says that it leads to 500,000 deaths per year. And again, this is a true study that they are citing. And it totally makes sense because that extra fat tissue leads to insulin resistance, poor cholesterol markers, high blood pressure, etc., and a bunch of things that lead to cardiovascular disease, stroke, and a chronic inflammatory state that even increases risk of cancer. So the Hims and Hers ad is not blowing out of proportion the obesity crisis that America is in and the negative impact that it has on individuals' lives. But why are obesity rates so high in America? And does this ad actually address the real reason? Well, it starts off by saying that something's broken, but it's not our bodies, it's the system. Well, this is partially true, but it's incomplete. The part that's true is that the system is definitely broken. And this hints on something that's a problem not just with weight loss care, but with general healthcare in America. And that is poor access to care and way too high prices for drugs and for other treatment. The ad mentions that the system really feeds on our failure. And that is so true because big pharma and insurance companies rake in money to treat disease, not to prevent it. And that's a huge problem with the American healthcare system. Specifically for weight loss, the ad mentions drugs that work but are just too expensive. And they're talking about semaglutide and tirzepatide. Semaglutide offers 10 to 15% average total body weight loss, and tirzepatide offers 20 to 25% total body weight lost while using the drug. However, if you just get your regular doctor to write you a prescription for it, your insurance company probably won't cover it for weight loss. And then you're going to be paying $1,300 per month to take these medications, which do work. So it's a shame that we don't have access to them for weight loss. However, is this the only problem? And the answer to that is definitely not. After all, in 1970, there were only 15% of Americans obese, compared to 40% today. And they did not have semaglutide and tirzepatide in 1970. So why have so many more people gotten obese. And this is another part of the system that is broken, and that is the American food industry. Since 1970, there has been a huge push in ultra-processed foods, foods containing high amounts of refined oils, refined sugars, and carbs, and not to mention Americans have a much more sedentary lifestyle. So our environment is set up for us to eat poorly and to not burn calories through movement. So this part of our system is also broken and causing all this additional weight gain and obesity crisis since 1970. So yes, totally agree that the system is broken. However, to say that our bodies are not also broken is actually a huge disservice to anyone trying to lose weight. And here's why. Many times there is something wrong with our bodies that's actually a root cause of our weight gain. That could be insulin resistance. Our thyroids could be deranged. Our hormones could be off. Our vitamin and mineral status could be off. Our guts could be inflamed. We could have cortisol dysregulation. And the list goes on and on and on. And in my practice, I commonly see people come in and try to get on these medications to lose weight. And before we put them on those medications, we look at all the underlying possible root causes and things that are broken with their body. And we fix those. And then guess what? They lose the weight. They don't even need the drugs. So yes, obesity in America is partially due to that broken, corrupt system. However, it's also due to all those potential underlying causes that are in our bodies. And if we do not fix those, and we don't fix the system, I agree with the ad. We are sick and stuck. Well, the ad then turns to their solution. However, is Hims and Hers an actual solution? Or is it just another marketing scam? Well, the ad shows that they offer oral semaglutide and subcutaneous injections of semaglutide. The oral version starts at $69 a month, and the injectable version starts at $169 a month right now. The oral version is not a good solution for weight loss. With the regular dosing schedule of oral semaglutide, you're going to lose about 5% of your total body weight, compared to that 10 to 15% of the injectable semaglutide. So if you are going to go with Hims and Hers, do get the injectable version and not the oral, in my opinion. But why are they only offering injectable semaglutide instead of the way more effective injectable tirzepatide? And how are they able to offer it at such a low price compared to those $1,300 per month price tags that we talked about earlier? Well, the answer lies in two words: compounding pharmacies. And what are even compounding pharmacies? Well, compounding pharmacies create customized medications per a physician order for a specific patient. And these specific medications can be different doses. They can be different formulations, such as a liquid form or a capsule or a nasal spray. They can also have different additives in them. If the patient might be allergic to certain additives, they can take those out. And this is important for this video, they can also produce drugs that are in shortage or low supply from the normal retail pharmacies or normal drug companies. However, they cannot produce an exact drug if it's not in shortage. So how does that apply here? Well, semaglutide and tirzepatide have both been on shortage in the recent past, meaning that compounding pharmacies can create this exact drug and sell it themselves. However, recently Lilly, the owner of tirzepatide, the brand names Mounjaro and Zepbound, have now caught up with the demand. So it's no longer in shortage per the FDA, and now compounding pharmacies are no longer allowed to legally produce it and distribute it. So that's why Hims and Hers is now only offering semaglutide instead of tirzepatide, because they are using a compounding pharmacy and not giving you that brand name medication. And this is also exactly why they're able to offer it at such a low price. The actual molecule that is semaglutide is not that expensive to make. However, because of patent laws, Novo Nordisk, or the owner of semaglutide, Wegovy or Ozempic, the brand name, is able to have no competition and drive those prices up very, very high. So a compounding pharmacy with much less overhead and no reason to drive the prices up high due to the fact that they have many competitors can keep the prices low, and that's how Hims and Hers delivers you that $169 per month price tag. So is there a catch to this super low price tag of semaglutide? AKA, should we trust compounding pharmacies? Well, I'll give you the information and leave it up to you. Basically, compounding pharmacies produce drugs that are not FDA regulated. However, they have to get their active components that they make the drugs with from facilities that are FDA regulated. And they have to be licensed in their state to be regulated by their state pharmacy boards. And they also have to produce products that live up to USP standards. So with all that information, my opinion is that you should really look into any compounding pharmacy that you're going to get a drug from. One, make sure that it is licensed in its state, and I'll give a link in the description to show how to do so. And two, ideally, they're also giving you a certificate of analysis, basically a document proving that the batch of drug that they're giving you lives up to USP standards. And for Hims and Hers, they do both of these. They have compounding pharmacies that are licensed in their states, and they also provide certificate of analyses for every batch of semaglutide that they'd send you. So, in my opinion, Hims and Hers is giving you an effective and safe drug when they ship you your semaglutide. And in general, I would say if you find a licensed compounding pharmacy that's giving you a certificate of analysis, I would trust that product. I generally trust compounding pharmacies if they meet these standards, even though they do not have as rigorous testing as FDA-approved drugs. However, even though we're getting a safe and effective drug, does this mean we should actually join their program? Is the Hims and Hers weight loss program and semaglutide going to result in lasting weight loss? Well, let's look at their entire program, their intake process, how they do their dosing, how they support you along the way, and see if it lives up to a program that will actually cause sustainable weight loss. So the intake process is very minimal. Basically, it seems that you fill out a questionnaire, you don't have to get any lab work, and basically the physician looks at that questionnaire and prescribes you a dose of semaglutide. Then after that, dosing increases are at the discretion of the doctor. And from what I can find online, it seems that they generally initially limit you to 1.25 milligrams of semaglutide, when the max dose is 2.4 milligrams. And if you actually go up to either 1.7 or 2.4 milligrams, from what I can find, and this is kind of a hidden fee, that extra dose will cost you. You're going to be up closer towards $300 a month at least, compared to that initial $169 a month price tag that we just mentioned. And then with this setup, what are their results? Well, their initial 1 month result is that men seem to lose an average of 11.6 pounds their first month, and women lose an average of about 9.3 pounds. However, they don't give any statistics on what their long-term weight loss success is. Now, are these numbers good? And are they actually giving you what you need to have sustainable long-term weight loss? Well, unfortunately, no, they're not. And let's talk about what they're missing and what you actually need to lose weight on semaglutide. First, the intake process has to change. Ideally, you're getting an extensive lab workup and you're talking with a physician or someone who knows about weight loss to talk about dietary and lifestyle changes that need to be made to actually give you a sustainable weight loss. For instance, I've had patients come into my clinic who, after an extensive lab workup, we find that their thyroid is super deranged. So we fix that, and then no semaglutide is needed. They lose all the weight naturally. Or we'll have patients come in who their gut is super inflamed, we find out. And then we find out they have celiac disease. We treat these things, and again, no semaglutide needed. The weight falls off. Or we'll have people who come in and we find out through their dietary assessment that they're drinking a couple Cokes a day. Well, we transition them to tea, and guess what? They lose 20 pounds in a few months. And finally, you might also find things in that initial assessment that will help you optimize your weight loss, even if you still need semaglutide. You might find that you need more of certain vitamins and minerals, or you need extra help with insulin resistance, etc. So actually getting to the root cause is going to be vital instead of just giving a drug and walking away. Now, what about the dosing? Well, I think this is actually a real bright spot for Hims and Hers. I love how they don't just ramp up to the max 2.4 milligram dose immediately. Many online prescribers and prescribers in person do this, and I think this is a very ineffective way to dose the medication. The most effective way to dose it is staying low and going slow. You really want to only use this medication as training wheels so you can actually get to the root cause of your weight gain. If you just increase that medication as high as it will go, you might lose the weight, but you will gain it back because you will not have been forced to work on the underlying causes of your weight gain. The unfortunate thing though with the Hims and Hers dosing is it does seem that the price increases if you get up to 1.7 and 2.4 milligrams, which is often required. And I would love it if that was a little bit more obvious on their website. And finally, what about their results? 11.7 pounds for a male and 9.3 pounds for a female in the first month. Is that good? Well, honestly, it's probably too much actually for the first month. And again, here's the importance of going slow. And one of the reasons it's important to go slow is you really don't want to lose your muscle mass while on this medication. If you lose weight too fast, you'll likely be losing muscle, which will hurt your metabolic rate and cause you to gain weight in the long run. So instead, it's really ideal to be losing about 0.5 to 1% of your body weight per week, or about 4 to 8 pounds per month. So losing 12 pounds per month initially could be risky that you might be losing some muscle. However, with a good program, it's easy to combat this on the med. Essentially, all you need to do is work on weightlifting and make sure you're getting enough protein. You do these things and you're probably not going to lose weight too fast and you'll maintain your muscle. However, what about their long-term results? They don't even mention it. And truthfully, I think that might not be a good sign in regards to their efficacy for long-term sustainable weight loss. So, should you use Hims and Hers? Is it a good solution? Well, truthfully, compared to other online prescribers, I think they're pretty good. I think you're going to get a safe, effective medication. However, to actually use that medication to have long-term weight loss, you're going to have to do a lot on your own if you do use Hims and Hers. You need to look at root cause. You need to look at your diet and lifestyle for that root cause, and you also probably need to do a lot of lab work to figure out where you might be deranged and where you can fix so that you can sustain your weight loss in the long run. You're also going to need to be patient, stay low, and go slow on that medication dosing so you don't lose weight too fast, you maintain your muscle, and you're forced to work on those lifestyle and dietary changes to actually sustain weight loss while using semaglutide as a good tool and a good training wheel while you do so. For a ton more tips on how to do all of that, subscribe, because I'm going to be releasing within the coming week a ebook on how to do all of this, and it will go into great depth all the lab work you need, all the dietary changes to make, lifestyle changes to make, etc. And 2, go ahead and watch this video for more tips right now.